Matthew Harvey, and this is my presentation on the cardiovascular system. So first up, we have the heart. The heart is it's the main part of the cardiovascular system. Its primary function is that it pumps blood around the body and gives blood to the necessary organs that need it. Its secondary function is to make sure that blood flows around at a constant rate, so it's not just pumping blood everywhere willy-nilly without regulation. Next up, we have blood and blood vessels. Its primary function is that it transports important vitamins and minerals to all parts of the body. It's the red liquid that flows throughout your body, and it's assisted by arteries and veins, which we will talk about in a sec. And then we have secondary purpose is that it's going to pick up waste found in the circulatory system, and it takes it to various organs for removal. We have veins and arteries. Its primary function is it just contains the blood in order for the blood to travel around the body, and its secondary function is to carry oxygen-rich blood to the lungs, which is what the lungs need to function. Fun facts of the cardiovascular system: your heart beats in the fastest when you're a baby. This is done to supply the babies with enough nutrients in order to grow, because that's the stage of their life when they grow the most. Your heart beats about 100,000 to 115,000 times a day. And your heart pumps about 2,000 gallons of blood a day. And your heart pumps about 0.5 gallons of blood a minute. 5, most heart attacks happen on Mondays out of every day of the week just because they're the most stressful. 6, laughing is actually good for the heart because it relaxes the blood vessels and just makes it easier for them to travel throughout the body. 7, a woman's heartbeat actually beats 8 beats faster than a man's heart on average. And 8, this is not a very fun fact, but sadly, out of every day of the year, most heart attacks occur on Christmas Day, similar to Monday, just due to stress and stuff that's happening. 9, in the average person's lifetime, the heart will beat about 2.5 billion times. And 10, the heart weighs about 7 to 15 ounces. 11, your heart pumps about 7 milliliters of blood a second. And heart disease is the #1 cause of death in the U.S., disease that causes death. And 13, your heart can work about 20% less before cardiac arrest can occur. 14, your heart expels about 2 ounces of blood per beat. And 15, the bigger the person, the slower their heart rate will be on average. Next up, we're talking about heart disease. First up, we have coronary heart disease. This happens when the coronary arteries struggle to supply the heart with enough oxygen and nutrients for the body to function at its full capacity. Those are these arteries right here, located on the outside of the heart. Its treatment includes lifestyle changes, there's certain medicines that can involve your cholesterol just to help that be regulated, and surgery will be needed if it is extreme enough. The peripheral arterial disease, this happens when your arteries thin. It reduces blood flow in your arms and in your legs. So just right here, these main veins coming down, they kind of constrict, and it's just harder for blood flow to happen. There's treatment like exercise programs, such as physical therapy. There's other medicines like antiplatelets. And surgery, of course, is needed if it gets too extreme. There's angina, which is just constant pain in your chest from lack of blood flow. There's treatment like nitrates, such as nitroglycerin, which are given to widen and relax blood vessels. And then there's arrhythmia, which is a disease that interferes with the rhythm of your heartbeat. The treatment, there are many medicines that help, but surgery is most commonly used to treat it. Thanks for watching.